Hi, everybody. Welcome to Center for Discovery's 15-minute Facebook Live, where we talk about eating disorder recovery and people working on their mental wellness. So I'm so excited today. I have Gabby. Do you guys want to introduce yourselves?
Sure. Yeah. Cheryl, you want me to go first? All right.
I knew that was going to happen.
Me too. Well, hi, everybody. My name is Gabrielle Katz, but I go by Gabby. I am the program director over at Center for Discovery, Alexandria Outpatient. We are a partial hospitalization program and intensive outpatient program. I'm a licensed clinical social worker as well as a certified eating disorder specialist. I've been in the eating disorder field, all higher levels of care from inpatient to intensive outpatient for about 6 years now.
Wonderful. And I'm Cheryl Phillips. I'm the clinical outreach representative for Center for Discovery here in Northern Virginia, where we have, as Gabby mentioned, intensive outpatient partial hospitalization programs. We also offer residential programs for adolescents and adults struggling with eating disorders. And additionally, we have programs residential and intensive outpatient partial hospitalization for our mood and anxiety program for both adolescents and adults. And I'm really excited. This is my first Facebook Live experience. I'm excited to be here today. So thanks for inviting us, Melanie.
Yeah, I'm really excited. Okay, so are we ready for our topic? This is a popular topic these days, and so we want to make sure we're supporting people during this challenging time. So the title is COVID-19 and Eating Disorder Treatment at Center for Discovery. Are you ready for your first question?
I am ready. Let's do this.
Okay. How are you still providing care to your clients during COVID-19?
Yes, that is a great question. So Center for Discovery, all of their partial hospitalization programs and intensive outpatient programs are now in a virtual platform. So we're actually still providing care to our clients, but from the safety of their homes. So the programming is in a HIPAA compliant and secure virtual platform.
Okay. Cheryl, do you want to add anything?
Well, yeah, just that it's been wonderful to see the creativeness and creativity of our teams and how we're in the moment coming up with strategies and ways for both individuals and families to access this care.
Absolutely.
Yeah, I was thinking about that this morning. It was literally like one day, and then you guys had to completely change your programming, and you did it, and it was incredible.
Yeah, and you guys might know the how many outpatients we have. It's like, how many total do you guys know across the country?
I don't.
I can't remember how many, but it's up there. It's a lot of programs, and I remember our CEO sent out an email saying that we were able to get every program rolled out to virtual within 2 weeks, which just with the amount of programs we have throughout the country. I mean, we're all over the United States. It was a quick turnaround, and it really was a team of our amazing operations team, executive leadership, our legal department. Everyone was really working together to make sure that we could get this rolled out as fast as possible.
And I also would add, working with insurance, we have the benefit of working with insurance and the collaboration with them as well to make sure that our clients are able to access and continue to use their insurance as well as TRICARE. It's been really nice to see.
Yeah, it was very impressive. You guys are incredible. I don't know how you did it. All right, ready for your next question?
As ready as I'll ever be.
No, I don't feel like it. What does virtual programming look like at Center for Discovery?
Yeah, okay, so that is a great question, and I think it's so valuable to go over in this because I think potential clients, outpatient providers, and families are really curious about what does this even look like. So the way that I like to describe it, I like to kind of go through the treatment process from admission to discharge. So basically how it works over here at Alexandria Outpatient is you're still working with our admissions coordinator for the admission process. But when you're scheduled to admit, the day before I will go ahead and email you your admission day schedule. So it's different than in person where you can come in, you get your welcome binder, you get your schedule. But so therefore, not but, I don't know why I said but therefore, I make sure I email you. So this email has your admission day schedule, who you're meeting with, what time, and then links to make sure you know how to get into these virtual meetings. On top of that, I'll send you a couple different documents to help describe what programming will look like, the dietary component, the group schedule, different things like that. So on the admission day, you are on this virtual platform meeting with all of your providers, your therapist, your dietitian, our milieu manager, and maybe even a counselor to really get to know everybody, to do assessments, for us to get to know you. Depending on the age, we're also meeting with families, parents, guardians, whoever that may be. Then throughout treatment, it is all virtual. So we are having clients sign on and they're doing programming with us, just like we're kind of doing this Facebook Live right now. Microphones, laptops, or smartphones, really trying to make sure that we're incorporating everything that we can. So what we do to make sure it's extra HIPAA compliant and confidentiality and secure is we actually send these links that they have to pre-register for programming the next day. So that's just an extra layer, and then a staff member has to approve them to come in to this meeting. And so there's lots of extra layers that we have to, again, make sure that everything is as secure and confidential as it can be, and then also to provide the best care we can. So we're still doing meal support, we're still doing groups every day, we're still having individual therapy sessions, we're still doing dietary sessions, and for our partial hospitalization program clients, we're still having our psychiatrists meet with them as well. So throughout programming, you'll get also a separate email from your therapist the Friday before every week. So that Friday, it will have the next week's appointments. It'll have your exact therapy session with a link, your dietary session with a link, and your psychiatrist session, again, if you're in partial, with a link. So it's very organized and very scheduled. So that way there is no confusion, and we're really able to be proactive and support our clients as best we can. And then let's go all the way to discharge. That would be just meeting with your therapist and whoever else you have to meet with on discharge day, completing all that discharge documentation, solidifying appointments virtually. And then we also have this really amazing resource at Center for Discovery, which is support groups. And they're actually virtual. So we can have support groups for loved ones, support groups for anybody in the community. We have support groups for alumni. I'm counting, you can't see my fingers, but I'm counting. And then, and then we have support group for clients that have binge eating disorder specifically. So that is another resource we can provide on discharge to our clients to make sure they're getting the extra support that they may need.
Yeah. Okay. So this kind of is going to tie into my next question. So maybe I'll ask you the last question and we'll talk a little bit about it. But the question is, what are some differences between virtual and in-person programming?
Yes, great question. So really what I'll say is, you know, the programming itself, I think, is pretty similar. The groups we have are still the same groups we offer in person. I have this amazing counselor who does kitchen skills, and kitchen skill is a very interactive group. I mean, if it's in person, we're cooking in the center, we're baking things, or we're, you know, having fun with food. And so this counselor I have actually emails the ingredients to the clients and the parents to say, hey, if you had these, or if you can get these before Saturday programming, you know, please do, because I'd love for the clients to be able to do this recipe in that group. So we're really trying to still make it as interactive as possible and still incorporate all the groups. The biggest difference, I'll say, is one, the schedule. So in-person programming, we used to be 12 to 7, Monday through Friday. And then on Saturdays, we're 9 to 3. But in virtual programming, we are 12 to 6, Monday through Friday, and we're still Saturday 9 to 3. And the reason behind that is because, again, our wonderful operations team and leadership is really trying to figure out how can we have our clients still engage and participate in treatment and be able to do it in a virtual platform. I mean, doing more than 6 hours of, being on a computer and doing all of these things is a lot. And so really trying to make it manageable. So that is one of the biggest differences. Another difference I would say is the amount of, what's the word I want to use? The amount of redirection or in the moment support that we can provide. So our clients, when we're in person, we can pull them to the side and say, hey, what's going on? Like, how can I help you? Or I see you're really struggling plating this. But in a virtual platform, we're just like this, like little boxes. So there is no one-on-one side conversation. We have to really be able to support them in this platform together. But with that being said, those are some of the differences in a challenging kind of way. In a really positive note, the thing I'm loving about virtual is we are in the DMV area, DC, Maryland, Virginia, and Virginia's a big state. And so, sometimes we can't treat clients that we want to treat that live 3 hours away, 2 hours away, one way, and we can now. And so that's really cool, being able to treat clients that maybe would never have had a higher level of care option is just one of the things that I'm really loving that we're able to do. I'm thinking of even just one client in particular. They were discharging from a higher level of care and there's no resources in their area. So if we didn't have this virtual platform right now, they wouldn't have had a PHP or IOP program. They would have just gone straight from a higher level of care to outpatient, which is a big jump. And so I'm really grateful that we're able to treat clients from further away.
Yeah, I think that's just amazing. I also I think clients who go into eating disorder treatment obviously want to know a lot about the food. Like, what does that really look like? And so when you snacks with you guys, right?
Wait, say it again. I think you cut off a little bit.
Okay.
One more time.
Yeah. So they have their meals and snacks on screen with you guys. So
Yes. Okay. So great question. So let me bring my little tea cup over here so I can kind of show it. So how it works is we have a staff member who is on virtual with them, and we have their meal plans in a secure virtual platform as well. So we know their meal plans. They go ahead in their real life setting. And that's another thing. I'm so glad you brought this up because it jogged my memory to make sure I say this is, another thing I'm really loving is the real world exposure that we are doing with virtual. So if a client is struggling with plating, if a client is struggling with behaviors, we are able to say, hey, go get your mom, go get her and bring her in, or go get dad, or go get whoever, your significant other, whoever's in the house with you right now, go get them and let's right now figure out how to support you. So we do that in individual sessions. We might even do that with meal support of really that real world support that we want to do. But the thing that you're talking about with that made me go on a little tangent, but to go back to what you were saying, because I just wanted to make sure I said that, is so for example, we'll go ahead, we'll have them plate in their kitchen with their real food. They'll bring it over to the screen and we'll say, okay, go ahead and tell me what you plated. And they'll move their camera down and show their cup or their food or whatever they have. And then we'll check it off. And we might say, hey, you need to go add more, or hey, you overportioned that a little bit. Do you want to, are you hungry and you want all of that? Or do you want to put some back? So really being able to help our clients throughout treatment in their home with their real food. And the same way we would do it in the center, but again, it's more virtual and on screen where we can't have that one-to-one as much.
And one of the other things we talked about, Gabby and I, have is the family support and how we're able to integrate the families being able to connect with one another that we normally would have integrated into our program, but with virtual, it's allowing families to have that engagement, which has been nice when perhaps in their busy lives they wouldn't have been able to do this, and be able to focus and be able to do that in a virtual way.
Yeah, that's Cheryl. Thank you for bringing that up also. So we have in-person programming, something called Family Intensive Program, which is when the families come into program for about 3 hours with us. And since we're not in person and can't do that, we're actually doing that virtually. So on top of all of the family sessions, we're still able to provide that as well.
Yeah, and I think virtual, being in the of the dynamic, right, with the other people in the home, whether or not, you know, they're coming in, maybe there's some boundary issues that they need to work on, how to communicate. And then I've heard another fun thing that like meeting their pets, right?
Yeah.
Well, they can bring their dog in their bedroom and kind of use the dog to calm down. And so I'm sure you've met a lot of pets.
Yes, all the time. So we sometimes even do like a show and tell where clients are hopping on and just showing different things in their room, whether it's pictures or pets. So it's very fun, and we can make it really fun and exciting for everybody.
That's wonderful. And that, you know, as we use DBT as a foundation for our programs, like to be able to incorporate these things that we didn't used to that are going to be so helpful for our clients long term. I hadn't heard about the pet. That's really fun.
Yeah.
Yeah, no, I do. I love that those real world experiences. I mean, that's the best way to recover. It's to have that. And then I know that's why we do a lot of food exposure response prevention. And the other thing is you're still able to run groups like experiential groups, right? And you do like, what do you like?
Sorry, you cut off again, but I think your question, it's okay, but I think your question was the experiential groups that we're doing. And so, so that's kind of like kitchen skills, like I was talking about with my amazing counselor. So being able to continue to do that. It's also different groups, like we've still been doing a lot of yoga and mindfulness groups. It's really hard to just talk through camera all the time. So we really want to be able to do that. One of my counselors is also doing art group. And so really trying to get creative of how are we going to do art virtually? You know, what does everybody have at home that they can use to do this? So all of these different groups we're doing, we really try to get a little creative. So it's not just talking or, you know, sharing screen and looking at, you know, a video or a picture on the computer, but really kind of having them implement this stuff and practice this stuff at home. I mean, I think that's so valuable.
Yeah, I completely agree. I can't believe it's 17 minutes already.
I know.
That flew by. And thank you for being patient with my internet that seems to always happen on these days.
Yes, not a problem.
Yeah. And so also, May is Mental Health Month, right? We're doing a lot for May. And I think what better time than now to get treatment for, you know, either mental health or an eating disorder. You can have, there's so many resources right now. People are really talking about it. So I just encourage people to like, when's the best time? And I hear therapists say the best time is now to get treatment, right?
Yeah, there's no special season or day or, you know, or time. I think it's if this is something you need to get the treatment now. And you know, there are so many resources and we're all still open and ready to help whoever we can. So we really shouldn't wait. You know, I always try not to use shoulds, but, you know, I think in this case, really understanding that it's important and we're here to support you and the best time is now.
I know. Thank you. I need to thank you for being an essential worker. Thank you so much. So we have another Facebook Live this week on Thursday, April. What's the date today? Oh my gosh, May 14th, and it's on and prevention. So I have somebody from American Foundation for Suicide Prevention doing this next Facebook Live with me, and it's at 11 o'clock.
That's Pacific time, 11 o'clock?
Yeah.
Okay.
Yeah. So, thank you.
So early to be with us here on the East Coast.
Yes, thank you.
Yeah, I'm in San Diego. You guys are in. All right, thank you. Have a great day. Bye, guys.
Thanks. Bye, everybody.